Good morning, everybody. My name is Jen Stallsworth. I am APD's Chief of Staff, and you are joining the quarterly Fall Community Members Update meeting. We're really excited to have everybody here today. We are using a new platform, as you can see, and we're still working out some kinks with this platform. This is a Teams webinar platform that we're using. It allows for registration, so we can add new community members to our distribution list, and it allows for automatic recording. We chose this feature as a webinar because Teams and Microsoft have been making a lot of strides in how they're changing and updating their information to meet hearing needs. And so and all kinds of accessibility needs. So I wanted to share my screen. First of all, I apologize. I want to first let you know we have our ASL interpreters here today, Melina and Linda. And so if you're able to maybe turn on your screens, Melina and Linda, and let us see who you are. Melina is pretty visible right now. I don't know if Linda, there she is. All right, and I'm going to walk through a couple of these features with you today. Okay, so there's a couple of things you can do here. You can see Melina's large, but if I hover over, oh, let's see if I can do this. Her name right there, I created her and made her as a signer, and I can use that and fill the frame with just her picture here as well. Similarly, I can do that with Linda. Additionally, if I go up under the More feature here, there are settings. So again, pointing out under the accessibility features, you can turn on your captions here. You can manage your signers here. It'll automatically do that. And then you have options to fit them to the screen. For your closed caption settings, there's multiple settings here where you can go into the cart link, which is Elizabeth Archer providing our cart today, or you can use the auto computer generated. You can also set your caption settings to different sizes and features and placements throughout this board. So I just wanted to kind of run through that with you today because it is a new platform for folks. So with that, I'm going to go into getting back on track with our presentation. It sounds like we have another hot mic. Just a reminder, folks, that if you are joining us, to please make sure to mute your mic. So we've got a lot of information to get through with you today. The slides have been curated and are a really great amalgam of all the different types of activities, work, and initiatives that are happening across APD. We've got support staff here and a whole plethora of folks here supporting this event. Our support staff are Julia Moses, Cheryl Ivy, or Tina Essery, Christina Essery. If you're having any technical difficulties, please reach out and contact any one of those three, and they'll do their best to assist you. We've also got our executive leadership team here today in support to help answer any questions. We will be sharing a survey at the end of this event and update, and we'd love to get your feedback on what you thought of the content and how the meeting went overall. Oh, and additionally, I'd like to note that there is a special session after our regular community partner meeting, which ends at 12:30, that we're going to be talking and introducing the agency with choice model and sharing that information with folks. So we'll be handing it over to Nikisha, and then we'll have a couple of special subject matter experts who can talk through that. Outside of that, I'm going to turn to my team. Oh, one last reminder. If you are, this is a meeting intended for community members. So if you are APD staff that are here joining us today, we just wanted to remind you that if you have any questions, to please bring that in-house, let us know and talk. This is specifically intended for community members. Elisa, Adrian, did I forget anything?
Thanks so much for asking, Jen. I think it would be good to explain to people that we have what we're just describing as a distracting issue with this platform with beeping when people come and go in the meeting. We are currently not able to address that. So Jen, do you want to speak any more about that? And it's we ask also if you to not come and go if you're staff, to please come and stay or leave, but don't come and go. And Jen, would you like to say anything more about that?
Yeah, it's been an unfortunate side effect that we've had. We actually didn't even turn the feature on in our meetings, but for some reason we can't seem to turn it off this week. So we really apologize for any of that distraction. And we'll work on it. We're working out the kinks still. Alrighty, with that then, I think, Nikisha, we're going to go ahead and turn it over to you. Talk about leadership updates.
Good morning, everyone. And I just want to thanking you all for joining us today. Really excited to be with you and really appreciate you all for taking time out of your busy schedules to be with us. If you haven't been in a meeting with me, my name is Nikisha Knight Coyle, and I am the Director of Aging and People with Disabilities. And I use she and her pronouns. So the last time we met, it was, I think, in June, and a lot of work has been done, and we've accomplished quite a bit since that time. And for today's meeting, we really look forward to talking with you about the work in progress across multiple initiatives in our program. One of the first things that I did after moving into this position about a year and maybe 20 days ago was I looked at our leadership structure and I evaluated its alignment with our current operations and projected growth. Our leadership team was not sufficiently designed to keep pace with the size and scope of APD and our AAA programs. So to support growth and to achieve greater efficiency, and also to allow for adequate and focused attention to the multiple facets of our work, I restructured our leadership team. And I believe I've shared some of this before with you all, but some of this is a reminder and some of this is a new introduction to a new member on our team. So one of the things that I did is I was thinking and looking at our leadership team was I added a deputy director role for 3 critical areas to our work. One for our safety and regulatory function, operations and policy. So now what we have in our leadership as a part of our senior APD team is a director and 3 deputy directors. Erica Miller is the Deputy Director for Operations, and she oversees our local office operations, disability determinations, HR, contracting, data, etc. Jane Ellen Wydans is the Deputy Director for Policy, and she oversees our Medicaid long-term services and supports, our community services and supports, meaning our state unit on aging services, and our AAA network and so on, as well as our policy and rule functions. And now I'm pleased to introduce a new member of our leadership team, Carissa Neufeld. She joined us in July to serve as APD's regulatory deputy. Now, the APD regulatory deputy director position oversees a variety of units that are responsible for the safety and well-being of the people that APD serves. And this includes like abuse investigations, licensing and compliance oversight, as well as our emergency response. Carissa was selected after a series of interview panels with APD and AAA leaders and managers, as well as APD community partner members, through a process that culminated in a town hall meeting for finalists. She's a seasoned executive with more than 25 years of public service and public administration experience at the international, state, and county levels, serving and advocating for people who have been economically and socially marginalized. She most recently served as the Human Services Division Director for Marion County Health and Human Services in Salem, where she directed the Marion County Intellectual and Developmental Disabilities Program, as well as several residential and housing programs for people who experience serious and persistent mental illness. So thrilled to have her be a part of our APD senior leadership team, and really to round out this leadership structure in ways that I'm just really excited to see the work moving forward. Okay, next slide. Before we dive into some of the updates, I just also wanted to remind you of priorities. So my highest priorities are ensuring consumer safety, strengthening equity through policies and protocols that examine our existing processes, and through improved demographic data collection, reporting, and the use of data for quality improvement purposes. And then the third priority that I have is around supporting an adequate and well-compensated and quality workforce, both internally to APD and through our long-term care workforce. I am delighted today to share updates on this work, the work that's underway in each of these areas. And we have a number of presenters that are gonna share where we're at on a number of our key initiatives. I'm gonna turn it over now to Nikki Holmes, and she's gonna provide some updates on our emergency response efforts. Some really exciting work underway. So.
Good morning. My name is Nikki Holmes. I use she, her pronouns. I'm excited to share some of the work that we've been doing at Aging and People with Disabilities around safety. Oregon, like the rest of the nation, faces a lot of increased number of emergencies and natural disasters, and it's crucial that we adopt and be ready to help people in need. We are super excited this year. We've been able to implement an emergency response management system. This system has got a ton of potential, and it's new in our work to be able to help people stay safe and be connected to services during the time of emergencies. Our emergency response management system gives APD the capability to track consumers and residents who live in facilities to ensure that services can still be provided during emergency events. This is a tool that can help case managers and other people who do the work regarding our consumers to identify who is at most risk and the specific needs that we need to address during that time. It gives us the capability to track consumer locations during evacuation and also provides cross collaboration within districts around the state of Oregon, as well as our agency community partners, such as the Office of Resiliency and Emergency Management. No longer will we be slowed down by tracking emergencies using spreadsheets and other inadequate tools. This is a huge step in the right direction for our program. Next slide, please. In addition to our emergency response management program, we just finalized an emergency support quick reference guide in partnership with one of our consultants, AC Disaster Consulting. This will also be a tool to help case managers in assessing immediate risk and needs during emergency events. It will also assist in our case managers having communications and conversations with our in-home consumers to address any identified risks and help them be prepared during emergencies. We will be sharing this guide with consumers as soon as we have the available variety of languages translated. I look forward to sharing more information as we move forward. Next on our agenda is Jane Ellen, who will provide an overview for our projects and initiatives.
Hi, everyone. Jane Ellen Whitens, APD Deputy Director of Policy, she, her pronouns. Thank you for joining us today. As you know, recruitment in our local offices for both aging and people with disabilities and our AAAs remain at a critical point, at a tipping point, really. So we are investing time and energy in doing different work than what we've traditionally done to try to recruit case managers specifically, but other staff as well. But we want to highlight this new video that we're doing for case management recruitment. Can you play the video, please?
If you have a drive to help Oregonians, this is the place to be. Hi, I'm Christy Shipman. I am the Aging and People with Disabilities Service Delivery Administrator. We are looking for people who have a passion to support Oregon's most vulnerable.
All they want is love. All they want is to be heard. It's the best thing in the world.
Case managers help to see if a person is eligible for long-term care services and supports.
You're just connecting people with resources or finding out what they need. Well, Margaret has just been a big success story. She really just wanted a safe place for her and her dog Bella, and we were able to get her into the place that she was really hoping to get into. It doesn't feel like work when you love it.
You put a face to the state of Oregon. You're respecting their identity, and you're also letting them keep their dignity.
Case managers are an important lifeline.
These are Oregonians that come to us in their time of need. And oftentimes, case management steps in to create a family, if you will.
My favorite part of the job is home visits, cup of tea, you know, all these stories. It's adorable.
Con el simple hecho de que te ayudamos, eso ayuda a que nuestro corazón esté contento y saber que hicimos algo bueno. At the end of the day, I hope they know that they did matter.
We have our own little community and we serve a big community. I have a team I can depend on.
I feel lucky and supported every day.
And I'm so very proud our case managers make sure Oregonians know options exist.
Found your forever home, huh?
Yes, I did. With you.
No.
APD case managers show up. This part makes me emotional.
I just wish there were a lot more like you.
We need people in this field.
Нужда большая и очень много людей русскоговорящих без ведущих, и нам очень нужно новых рабочих.
Y saber que eso es una bonita meta y una bonita carrera de que te trae mucho amor, mucha felicidad saber que ayudaste a alguien más.
Oregon needs case managers very badly.
She said, I'm so thankful that I have good people in my life. I cry less now because of that.
I love my case manager. I don't know what I would do without her.
If you have the passion and you have the drive, we want you. We want you on our team, and we need you.
I'm going to take a second because I'm going to choke up. So that's the second time I've seen it, and I'm still emotional about it because it's so true that our staff, and I just want to do huge kudos to all the staff within Aging and People with Disabilities and our area agencies on aging. They're really heroes across the board. And it doesn't matter if you're in central office, licensing, adult protective services, local case management, all of the folks are amazing, and we are lucky to work with them. Next slide, please. I did want to provide a high-level update on our collective bargaining update. I think everybody knows that we have two bargaining tables that represent a huge part of our workforce that serve Oregonians. One is our home care worker table, and the other is our adult foster home provider table. The home care worker collective bargaining is still in ratification. So just a high level is base wages will increase significantly in January of 2024. There'll be new differentials that will be available to support Oregonians that are providing care to the people we're charged to serve. And other changes will reward longevity and increase workers' ability to serve consumers. So we're really looking forward to that being ratified. The adult foster home provider table was ratified, so that collective bargaining agreement is now what we're running under. Adult foster home providers will receive a rate increase of 5% on December 1st of this year, and another increase later in the biennium on May 1st of 2025. So 5% and then a 4.5%. We've also committed that the adult foster homes will be included in the wage and rate study that I think I'm mentioning later, but really highlighting the needs for appropriate rates for our adult foster homes as we move forward. Next slide, please. We've been talking about our Oregon Project Independence Medicaid 1115 demonstration waiver for quite some time. I just want you to know that it's still on our radar screen. We are still discussing with the Centers for Medicare and Medicaid Services. They've told us that they still expect a decision in December, and we are holding them to that. So in the meantime, we are still working with the area agencies on aging and our local offices to make sure that we are ready to go. Draft rules are pretty close to being finalized. We'll be sending them out for the committee that's been working with us for feedback pretty soon, and then we should be able to finalize those and be ready to go for an early 2024 implementation. Sorry, I had to think about the year. Next year is 2024. So, and I'm very excited about actually getting this off the ground. Next slide, please. Other good news, under the Governor's Behavioral Health Initiative, there is a new collaborative underway between the Oregon Health Authority and APD to really focus on how do we align the 1915K, which is the authority that we fund things through. We often say the waiver, but it's actually we fund most of our services through the 1915K, and Oregon Health Authority has a 1915I. And the underlying goal is really to make sure that people are not falling through the cracks and that we're coordinating better for the multitude of people that are eligible for Medicaid in Oregon, and make sure that we are serving people where it doesn't feel like we're finger pointing and that we are promoting those equitable services. Next slide, please. So the other piece that's important to know is CMS came out earlier this year and was looking at what is called the HCBS settings rules, and we're assessing how states were doing. And it's the first time CMS has come out and looked at how states were doing. We had submitted a transition plan when the regulations first passed, and that had been approved, and we had to be in full compliance by 2018. And if people remember, that's right before COVID. So I think things have slipped a little bit since COVID. So everybody's doing the best they can. Sorry, my allergies are kicking up. But CMS did have some findings. Things like access to the greater community, able to self-direct individuals' daily lives, like when do they eat, when do they take a shower, when do they go out in the community, what do people want to do, and are they able to do that? They also highlighted right to privacy was an issue, and the lock-on entrance doors to the individuals' bedrooms and bathrooms were an issue. They also kind of highlighted that we are not fully implementing our individually based limitations, and that the knowledge that direct workers in facilities may not know about the HCBS criteria and they can't articulate it. So we are in the process, next slide please, of a corrective action plan. So we're developing informational materials on HCBS rights for individuals receiving those services. We're providing online trainings for providers, case managers, and their supervisors, and licensors and surveyors. And that training is not intended to be a one-time training. That's kind of what we did before. We went out, and I saw Petronella's on today. We were out talking with her providers in her association. We were out with the Oregon Healthcare Association and Leading Age. We were out there a lot, but it was a big push, and then we stopped. And what's really apparent is that we can't stop with the staff turnover in both local offices and on in our providers in our licensed care settings. We need to have permanent training. That's just a regular process that we're doing. We're also ensuring that we are partnering with the long-term care ombudsman on this, and more work to do on that. We're making sure that our regulatory compliance, which is one of the key pieces of this system, is updated, and that we're going to be reviewing quarterly reports on facility compliance at the executive level of the organization to make sure that we are getting back into full compliance. Next slide, please. Another big project is Healthier Oregon, and people probably remember that Healthier Oregon was funded in 2021 through 2023 to include what the state calls medical assistance, so the Oregon Health Plan and long-term services and supports for people regardless of their immigration status. And what's happened since then is that we have not seen the caseload growth that we would expect in this population. And at the same time, the legislature invested more funding to now have that we can serve anybody over the ages of 19 all the way up to death, right? So we're going to serve all ages, but we need to make sure that people understand what long-term services and supports means, because that's terms we use because we all are advocates and we work within the system, so we know what that means. But now we need to get out and talk to people about what it means for them, that we can help them stay in their own home, that we can help pay their family members to provide that care. We can help them find a place to live if they're not in a safe place. So we'll be working with community partners throughout this biennium to really make sure that older adults and people with disabilities have access to these benefits for which they're entitled. Next slide, please. Good news, we submitted and received approval on our state plan on aging. This is really about the Older Americans Act programs that we administer for the state, that we do this in collaboration with the area agencies on aging across the state. And it really documents tangible outcomes that the Older Americans Act funding is supposed to and the services are supposed to deliver. It translates our activities and data into best practices. It provides a blueprint for us around coordination and advocacy activities so that we know what we're doing with those programs. And in this time, it's really looking at building capacity for the future of our programs across for the long term within our program. Next slide, please. Here's some of the goals, and I want to say kudos to the Community Services and Sports Unit that led the effort to get the state plan finalized, and thank you to all of you who contributed to the work to develop these goals, because we can't do this in a vacuum, and we appreciate your work. And again, this is specific to the Older Americans Act programs that we administer, and the Medicaid program is slightly different than this. More to come on that later. But you can read these. I'm not going to read them availed, but you can see the goals is really moving forward and improving the well-being of our communities and the individuals who qualify for Older Americans Act services. Next slide, please. Senate Bill 420, so some legislative work. Senate Bill 420 created a brain injury program in APD. It will create for the first time in state in Oregon a brain injury navigator program that helps people not just do what we normally do, which is navigate our system, and we do a great job at that, but really focusing on people with brain injury across the entire spectrum of the things that are barriers for them to recover and be as independent as possible. So it's working with the Veterans Administration, Housing Community Services, Department of Consumer and Business services around private insurance and workers' compensation. It's working with local governments. It's working with private companies. It's working with VR. It's really about getting people to the right place and helping them along the way, all the way through the process to get them to the place where they need to be. The bill also created an advisory council. We're in the process of beginning to recruit for that, and we'll be getting information out broadly to all of our community partners about that possibility. Next slide, please. Senate Bill 99 passed in the 2023 legislative session, and thanks to O4AD, the Oregon Association of Aging and People with Disabilities, who really took the lead on getting this passed. The bill has two major components. It establishes an LGBTQIA 2S plus subcommittee in the Governor's Commission on Senior Services to really help both the governor's office and aging and people with disabilities to focus on the needs of this community and to make sure that the services and programs that we're delivering are meeting the needs of this population. It also enacts a Bill of Rights for LGBTQI2S plus older adults, residents of long-term services and supports, community-based care facilities, including adult foster homes, assisted living, and residential care facilities. In the bill, it included adult foster homes that serve individuals with intellectual and developmental disabilities, and foster homes that include individuals served through the behavioral health system. So we're working collaboratively with them on implementing the Bill of Rights. And then the bill also includes required training. So we're working with our community partners, including Oregon Cares partners, to develop that training and make it available to all of our providers. And the governor's office has begun recruitment for the subcommittee, so please keep an eye out for that. And if you're interested, let us know, and we'll make sure that you get the application link so you can apply. Next slide, please. Oh, kind of already went through that. So, but I will mention that we are also still working on drafting an action plan to address the needs that were in the LGBTQ older adult survey. And we're working in collaboratively with the OHA adult suicide prevention staff and OHA staff on social isolation, and really strengthening our work with the older LGBTQ plus older adult coalition. And then our state plan on aging also includes information on the LGBTQIA2S plus action plan. Next slide, please. Senate Bill 5506. So for those of you who don't know, that's our funding bill. And in funding bills, they give us money, but then they also can direct us through what are called budget notes to take on additional work. And for specifically this time in that bill, 5506, requires APD and the Office of Developmental Disability Services to do a rate and wage study for our providers. We are conducting or working with Burns and Associates, who has been helping ODDS previously, to really look at the system overall. We're going to be sitting down with multitude of groups and really doing a deep dive in our system. We've been educating Burns and Associates staff on the APD system since they're more familiar with ODDS's system. And some of the areas that we'll be looking at is how do you level set on acuity, because the individuals with intellectual and developmental disabilities have a different acuity rating scale than APD does. And then really what are the components in a rate structure that we need to make sure are included. And then the findings are due to the legislature next fall. Next slide, please. Additionally, the House Bill 3396 is a task force created by the legislature on hospital discharge delays. And you can see a lot of information here. ODHS has a representative, that's me. Oregon Health Authority has a representative. The governor's office has a representative. A lot of our hospitals have representatives, and our direct care providers have a representative on the committee as the task force as well. And we've just started meeting. We had our first meeting, and it's posted on OLIS if you'd like to go look at it. We did a presentation about kind of what is discharge planning and how does it work and who's responsible for what, really trying to educate everybody so that we're talking the same language. And then we'll be diving into all of these different issues and how do we improve the system for Oregon. Next slide, please. And now I'm sorry, I'm doing this one too. Sorry. So I did want to highlight some of our community engagement work around equity. The Southern Oregon Deaf and Hard of Hearing Work Group, it was created with the Disability Services Advisory Council. So many of you know that all of our local districts and our AAAs have required in statute to have a Disability Services Advisory Council that is to advise the local office on the needs of people with disabilities. And this network that's been created is really looking at how to improve communication for people who are deaf and hard of hearing in Southern Oregon, especially in healthcare settings. And the network includes the DSAC. It includes people who are deaf and or hard of hearing. It includes healthcare providers and the CCOs. It includes ODHS, and then advocates and ASL interpreters as well. Next slide, please. Some of the work that they've been doing is they've hosted a forum to educate and inform providers, healthcare providers specifically, of the challenges and solutions. They gave hearing loop demonstrations in partnership with All Care and Jackson Care Connect to show people how hearing loops work and why they're a good thing. And as a result of the demonstration, the CCO is installing hearing loops in Jackson County throughout 2023, and sites will demonstrate technology in 2024. Next slide, please. So other issues they've connected with the Medford Police Department livability team. They've created learning content for healthcare providers around deaf and hard of hearing issues. And they've encouraged the coordinated care agents organizations to add an option for people to select ASL as preferred language. And the CCO websites will now provide signed and captioned videos on their websites. Next slide. That is it for our broad overview of some of the work that we're doing right now. Nikisha, I think I turn it back over to you.
Yes, thank you, Jane Ellen. A lot of great work happening. I want to thank everyone for being here today and for engaging with us. As Jen mentioned in the beginning of the meeting, we'll be circulating a survey to put on these meetings, and if they're meeting your needs. We want this time together to be useful for you, which means we want to be able to address the issues of highest concern and priority for you. We've set aside time following this meeting for a discussion about agency with choice, which is a model that's currently being proposed for Oregon. Now, everyone is welcome and encouraged to stay for that discussion. And if you can't, that's okay. This will be the first of many future discussions on agency with choice. So I'm going to turn it over to Jen to help with this next the next few minutes before we transition.
Sure. Nikisha, there's a couple of questions in the chat. We've got one from Tina on, can you share at this time what the home care worker providers differential wage will be based on?
So thanks, Tina. The answer is not yet. We don't communicate out until after the union ratifies the collective bargaining agreement. So as soon as that's done, we'll be communicating broadly with folks. And then on the ICP participant, the question from John is, will ICP participants, caregivers get wage increases? The Independent Choices program is a self-directed program where the individual gets a cash benefit and then uses those cash benefits to meet their needs. So yes, their cash benefits will go up. They will decide if that goes towards wages or not. And yes, ICP participants will be included in the surveys.
Yeah, well, we have a few moments. Does anybody else have any other questions? Ooh, looks like Joseph Lowe, District 7, will be starting their DSAC very soon with 7 newly recruited members. Way to go, District 7. Woo! I guess, Jane Ellen, on some of the legislative implementations that you talked about, I was curious myself, are we soliciting new advisory council members, or is that ongoing?
So the Governor's Task Force, the Governor's Commission on Senior Services, LGBTQ plus Advisory Committee, the Governor's Office is actually doing that recruitment. And then for the Brain Injury Advisory Committee, which the department is directly appointing, we're starting those recruitment efforts shortly.
And I can answer Shayla's question. Yes, Shayla, the meeting is recorded. Thank you. We'll get that out as quickly as we can. Mary Jo Carpenter, adult foster homes. Though the increase in pay is a good step, what process is in place for exit interviews, data on adult foster homes that have closed to help determine what barriers they experience that caused their closure?
Thanks, Mary Jo. We have, and I went off camera. Oh no, I'm back on camera. Sorry, I went off camera because my system's being unstable. But we have not determined if we are doing exit interviews regarding closures. I'll take that back. We are including adult foster homes in the rate study. And part of that is to really determine if the APD and ODDS rates are meeting the needs of providers to meet the costs that it costs them to run their program. And I know that our loss of adult foster home is really dramatically difficult. And then on Senate Bill 1556, added a couple of numbers in there. The bill was passed in 2022. We are in the process of finalizing rules, and we are in the beginning discussions with the Oregon Health Authority on lining up the requirements and criteria to be a caregiver across the home care worker program and the in-home care agency program. And we are in the process of soliciting a platform for the registry.
And then Petronella asked about anything being with workforce issues. I'm not sure which workforce, Petronella, you might be referencing. Is staff, APD staff, AAAs, adult foster home, direct care workforce, all of the above?
I just muted myself. Can you all hear me?
Yes.
I think all of those above that you just mentioned. And on top of that, I think though too is I'm speaking. I flew down to Washington D.C. and I spoke to 25 congressmen and women and see if we can do something with visas.
Have not looked at working on visa issues. That's an interesting concept. We are developing bear with me on the term, I don't think it's quite right, but a strategic plan on workforce. It's one of Nikisha's critical priorities. And for us, workforce means direct care workers and RNs and everybody we need in the long-term services and supports provider network, but also in our local offices. So that strategy is being developed, and I'll just put that little bug in the back of my ear and keep it in mind that looking at visas may be a way to address some of the problems. Mary Jo is asking if there's discussions about tiered regulations for urban versus rural areas. We have not talked about regulations like the licensing requirements for rural areas versus urban areas. There is some discussions, very, very late, just baby steps, discussions with the legislature around potentially differentials for rural areas in Oregon. There was legislation in 2023 that would have, as an example, for PSWs and direct support professionals in the IDD system, would have paid them for mileage, the time it takes them, not just the time, but the mileage reimbursement from their home to the consumer's home. That bill did not pass, but we're looking at other ways of supporting rural providers. Yeah, Mary Jo, that's, I got that you were thinking about policies. We have not discussed different policies for urban and rural areas. I think our partners our staff in the licensing side. If you have ideas, we'd be happy to take those and take those ideas under advisement. The next question is there an update on the AAA contracts for 7/1/23 and 6/30/2024? Those contracts are with our Office of Contracts and Procurement, and we're working on getting them out as soon as we can. And we can get the AAA's more specific information about that.
All right. It looks like maybe the questions are slowing down. If you have any other questions, please feel free to drop them in chat. And again, at the end of our webinar today, I'll be dropping a survey, so feel free to provide any questions there or any feedback. Nikisha, do you want to go ahead and take on kicking off the agency with choice at this time?
Yes. Why don't we take a couple of minutes to transition? I'm not assuming that everyone on this call right now wants to participate in that. So take the next few moments. Those of you who are transitioning off, thank you for joining us this morning or now this afternoon. And for others, just take about a 5-minute break.
That sounds good. So we'll come back about 12:25 or so.
Yeah.
All right. Sounds good. Thank you. All right. Well, it is 12:26. I hope everybody got up, got a stretch, took a minute for yourselves. We're going to take this time and go ahead and transition this over to a special kind of session on the Agency with Choice overview. We have a few extra folks in here helping support this effort today. We've got Katie Diffendorfer, who's one of our communications officers supporting workforce, and a bunch of our policy experts, many that you know, Max Brown, Matt Raposa, of course, Jane Ellen and Nikisha are here. And I believe our government relations person, Justin, might be joining us, or at least he's viewing us to help field any questions. So with that, Nikisha, I'm going to go ahead and turn it over to you. Oh, I see a thumbs up. Must be here.
I bet that's Justin's thumb. Justin with him.
It is indeed. Thank you.
All righty.
Okay. Well, thank you everyone for joining us for this important discussion. We're really prepared today to share of the concept of agency with choice, and really this is really a little bit of a high level initial sort of engagement on this. And as I said earlier in my introduction, expect a lot more engagement to come on this. And so I think I'm going to turn it over to Jane Ellen and team. We've got a number of subject matter experts here to help walk us through some slides, and then we'll see what questions you have. And then we'll just take it from there.
Thanks, Nikisha. I'm going to go back on camera and I think I'm doing the slides and then opening it up for questions and see who's going to jump in and answer. So there was proposed legislation in 2023 session, and there is likely legislation being proposed. It's actually in development for 2024. It would create a new agency with choice model in Oregon. And the agency with choice would create a new service option for consumers that are receiving those services in their own home. So we're going to discuss that because we haven't really discussed it as a system, as Nikisha was saying, and we really just want to get people's feedback and thoughts and start developing where we go from here. Next slide, please. So what is an agency with choice? It's a proposed alternative model to the current consumer employer program, right? So in Oregon right now, we have two primary options for in-home consumers. We have, well, let's say three. So we have three. We have the home care worker program where the consumer is the consumer employer. We'll talk a little bit more about that. As a subset of that, we also have independent choices where the individual gets cash benefits and then can take those cash benefits and purchase the services on their own. And then we have licensed in-home care agencies. The in-home care agencies are licensed by the Oregon Health Authority Public Health Division, and then we contract with them to be Medicaid providers. So under the agency with choice model, it would apply to individuals who receive only benefits through APD. So it's not the home care workers, personal support workers, personal care attendants, it's really APD. It would direct APD to contract with up to 2 agencies to provide this new model, this agency with choice model. And then the agency would assume full employer responsibilities for consumers and for the department. So the department would no longer be a joint employer for any purpose. And consumers would be able to choose to be consumer employers, use our current program, use an in-home care agency, or move to the agency with choice. Next slide. So here's a list of the proposed responsibilities for the agency with choice. The agency would do the pre-employment screening, training, and recruitment of workers. They would take on all of the employer responsibilities such as payroll, time off, paying vacation, all that. They would decide on and authorize the benefits to the workers. They would make sure that the workers are showing up and providing the care, and they would hire people and fire people. I guess dismissal, but I think of it as firing. They would also have regulatory oversight of the workers, so they would be investigating abuse internally. They would be looking at workplace safety and doing quality assessments. They would be training, and we use the term home care workers here. I'm sorry I missed that. They would be training the direct caregivers. So these are no longer home care workers, right? Because home care workers are in the consumer employer program. They would be training those direct caregivers. They would also be training consumers on how to manage their consumer responsibilities, working with the agency's staff. And they would also ensure that backup providers are available, similar to how in-home care agencies do today, where there's an open shift and the in-home care agency has to staff that shift. Next slide, please. So a comparison of in our existing services, right? So we often use the term Oregon Home Care Commission to mean the program. The program as defined in our state plan and waiver is the Consumer Employer Program because it is a truly self-directed program. And there's government responsibilities in there, but the consumer has a lot of role and responsibility in the Consumer Employer Program. So in general, here's the breakdown. ODHS, Aging People with Disabilities, determines an individual's eligibility. We assist and work with the consumer to develop the service plan, and then we authorize the services based on that service plan. We pay home care workers on behalf of the consumer employer. We enroll qualified individuals as Medicaid providers, i.e. they become home care workers. After they've had a background check, we make sure they're not excluded from the Medicaid program because of problems in our state or others, et cetera. And then we give them a provider number, which allows them to serve any consumer who wants them to serve them. And we provide regulatory oversight of home care workers. And what I mean there is we enroll them, but we can also terminate them for cause. And that regulatory process of making sure that they're providing the care that they're supposed to do in the way that they're supposed to do it is under the umbrella of Aging and People with Disability. And then we also pay the trust negotiated between SEIU and the department on behalf of the home care workers. So it gives them access to paid time off, supplemental benefits, et cetera, that are all paid through the trust. So the Oregon Home Care Commission's role is they act as the employer of record for collective bargaining. So I just mentioned earlier in our previous session that we just finished collective bargaining. The official signer on the document is the Oregon Home Care Commission, even though we do it in partnership with APD, DD, and behavioral health. But the Home Care Commission also sets training requirements, procedures, and certifications, and sets overarching concepts of home care worker, such as a drug-free workplace. They offer resources and consultants to help employers hire and manage their home care workers. They can help people write ads. They can help them write job descriptions. They help people when there's discipline problems and they want to have a heart-to-heart discussion with their care provider. All of those things are part of the Home Care Commission responsibility. They also, by statute, provide a registry for employers to find qualified home care workers. Next slide, please. This is a list of the consumer employer's responsibility in the Consumer Employer Program, right? It is the decision of the individual who is going to provide their services, and they have to be able to manage these responsibilities. Now, we have some supports to help them do that, but these are fundamentally their responsibility. So they have to locate, screen, and hire a qualified home care worker. They have to notify the case manager that they've selected that particular home care worker and they want that person to work a specific number of hours. So I want Joe Smith to be my home care worker, and he's going to get 75 hours every 2 weeks to meet my needs. That is the consumer's responsibility. They have to supervise and train the home care worker to specifically meet their needs, how they want things done in their home and with them. They have to schedule the home care workers time, like you're going to be here Monday through Friday, 8 to 5, just made that up. And then also when that home care worker needs to take time off, they have to make sure that they have scheduled and adapted their service plan to cover that leave time. We've changed things a little bit on how they track hours, but so they don't have to go in and sign the vouchers anymore because we use the electronic visit verification system, provider time capture system. But they do need to make sure that the home care worker is not working more than the hours authorized. So if they have 2 home care workers, as an example, they need to make sure that Joe, in my previous example, Joe is only working the 75 hours and Sue is only working the 25 hours. And they need to make sure that those hours are authorized correctly because they can't just switch it up. They need to recognize and attempt to correct any performance issues with the home care worker, stuff like, I don't like how you're helping me bathe. I like how you're doing this, but I would prefer it slightly different. when you go shopping, I don't want you to pick up this, I want you to do this, right? That's all of the consumer's responsibilities. And then if they're still not happy, they can discharge a home care worker that's not meeting their needs. And that's different than the APD responsibility, where we terminate providers. So we take away their ability to serve Medicaid consumers and Oregon Project Independence consumers, and because they've done something that is against administrative rules, they've done fraud, they've done abuse, something like that, where we terminate a provider. But a consumer employer has the right to say, this person's not meeting my needs and I don't want them to be my caregiver anymore. And then they also have to guarantee that they're following all employer responsibilities required by law to ensure that the workplace is safe from harassment. Next slide, please. So just to highlight some of the consumer employer program and the agency with choice differences. So the Oregon Home Care Commission and another program right now called CARINA provides consumer employers with a registry of home care workers from which to hire. But the consumer can also say, my neighbor wants to become my home care worker. I want them to be my home care worker. And that person applies, gets a Medicaid number, and then that is that individual's home care worker. Sometimes it's a family member, sometimes it's a friend or a neighbor, but there's also this registry out there. In an agency with choice model, agencies will have caregivers from which the consumer can choose. Similar to the Oregon Home Care Commission Consumer Employer Program, the consumer can say, I want my neighbor to be my caregiver, and then the agency will enroll that provider to become that consumer's caregiver. But the agency will also have a group of people who are available to provide care. In the current system, hiring directly gives the consumer the ability to select their workers to meet their needs, including language spoken and cultural preferences. It can go way beyond that. It can be specific training that they want to have the home care worker to have gone through. It can be the length of time somebody has been a caregiver. It's all kinds of different things that the consumer gets to select. In an agency with choice model, the agency works to find caregivers that meet the consumer's need. And they have a role, the consumer has a role in selecting the caregiver, but control is much more in the agency with choice's hands. In the current program, consumer employer is responsible for finding replacement home care workers when they are needed. So their caregivers going on vacation for 2 weeks, they need to have a backup plan in place that supports their needs during that 2-week period. Under an agency with choice model, the agency covers all the needed shifts. If they're scheduled to work Monday through Friday, 8 to 5, it is the agency's responsibility to make sure that caregivers show up to that, to those shifts. And then the management is in the current program, the consumer manages the home care worker. And in the agency with choice model, the caregiver is an employee of the agency, so the agency manages the caregiver. Next slide, please. Oversight. So the consumer employer and the home care worker can report grievances or issues to the Home Care Commission. They can also report concerns and issues to the AAA or the APD local offices. And when the APD and the AAAs have a responsibility to ensure that the consumer's employer's needs are being met, right? That they're not getting sicker, that they're getting food, that they are getting their assessed needs are being delivered. In an agency with choice model, the consumer and caregiver address any concerns through the agency with choice that employs the caregiver. So case managers will still have a responsibility to ensure that individuals' care needs are being met and will still address issues of neglect or positive accolades, not just always negative here, but it's really the relationship changes because the direct oversight of that individual caregiver is now with the agency with choice. Timekeeping and pay. Home care workers submit their time through the provider time capture system, and then we review the hours to make sure that they're not over the hours, and then we pay the home care workers. In the future agency with choice model, the agency handles all the timekeeping and pays the caregiver. Next slide. And I'll get to questions in a bit. I don't think I can answer questions while I'm trying to go through all the slides, so I'll answer those questions in a minute. When we talk with the proponents of the bill and about why they're pursuing this is and we acknowledge that many of these issues are correct. So there's a shortage of home care workers, meaning some caregivers, some consumers go without the supports they need. And sometimes that shortage is not that there's not enough caregivers in the local community. It means they haven't been able to match each other. So there's a caregiver who wants to work and there's a consumer who needs someone to work for them, but they haven't been able to find each other in our current system. And then many home care workers are frustrated by the state enrollment process. As an example, our background checks can take a long time, so they want to work for their neighbor and they're waiting for that background check. And in the meantime, the consumer had to find another caregiver to step in and meet their needs. And that individual who wants to be a caregiver then can't provide care and can't be paid. We also have problems with our state payment systems, which cause delays and errors in payments. We call them late pay and partial pays, and that's an ongoing problem for folks. And there's a lack of support when issues arise with the consumer employers. So a home care worker feels like they've been harassed, or that there's a dramatic change in condition and they don't know what to do to meet the consumer's needs. They don't feel that support. And these are huge generalizations here, and there's many more issues. Also point out that some states have found agency with choice to be successful. We've done a report on this, and Max Brown's happy to send it out to you. Most states with agency with choice provide this option to individuals with intellectual and developmental disabilities. And then fewer states are using agency with choice for older adults and people with physical disabilities. I have to say, some of those states don't have as robust in-home program as Oregon does. We're still serving between 52 and 54% of the people we serve in their own home. Fluctuates over time. Some states are serving less than 10% of older adults in their own home. They've relied on licensed care settings more heavily. So I think that there's reasons why states have not adopted agency with choice for the older adults and people with disabilities side of their systems. Next slide, please. So that is a really fast and really high level overview. And as Nikisha said at the beginning, this is just our first step in a discussion that we want to have with you about the agency with choice model and what would it look like in Oregon, and is it the right thing for Oregon? So we'll open it up for questions. And Jen, are you moderating or am I?
Yeah, I mean, we can tag team this, like we do. So there were a couple of questions, and Justin made such a great point to me to acknowledge that I wasn't thumbs upping the question itself. I was acknowledging that we saw your question and we'll get to it. So thank you for that. And it looks like Matt answered Shayla's question, but let's go ahead and read it for those for ASL. Is a proposed model, or is DHS moving forward with this model? And Matt, do you want to explain your answer?
This is Matt. Yes. So basically, it's something that was the concept was proposed in the 2023 legislative session, which did not pass. We anticipate the bill will be up again in the 2024 legislative session. So we're using this in part as an opportunity to get feedback from our community partners on their thoughts, on your thoughts on this concept.
And Matt also answered that the Independent Choices program is not going away. This is adding, and it's not intended to eliminate the consumer employer program either. Some states have done that. They've gotten rid of their consumer employer program and just gone to agency with choice. The concept in the bill is that it's a new addition to help people, not a replacement of what we currently have. So we'll still have consumer employers with home care workers, independent choices, and in-home care agencies, and then agency with choice will be a new program. And question, and I'm sorry, Andrea asked if I heard correctly, a comparison slide, consumers can select a neighbor friend as noted under CEP. They just under the agency with choice, they would just have to be approved by the agency. So it is a little different, right? Because the agency with choice, the intent is still that there is some level of self-direction for consumers, but the agency may decide that the neighbor is not an appropriate person to provide that care and may have different qualifications than what we have in the consumer employer program. That would be yet to be seen, and it's an unknown. But in general, the idea is that the individual can still select their friend or neighbor or their niece or nephew or children to provide the care for them.
Thanks, Janelle, and it's Sandra. If I can just chime in, I guess it might be helpful to just clarify that slide a little bit more, that ability remains. There just may be additional hurdles or steps one has to take. But when I was looking at the slide comparison, it felt like that ability was gone under the slide with agency with choice. And so I'm just trying to track the bouncing ball. Thank you.
Yeah, I do think the agency will decide if the individual is qualified to meet the needs versus the consumer determining that in the consumer employer program. And John, won't this become another bureaucratic layer? I don't know if I would say it's another layer, but it is another bureaucratic system, right? And I think that case managers will have to be working really closely with the consumer to say, here's all your options, right? And here's the pros and cons of all of those options.
Did you see Shayla's comment there?
Yeah, thank you, Shayla. I don't know if everybody can look at the chat online. So just say that Shayla Duke said, I think that many APD consumers don't like being told who they can and can't hire. They like to hold on to their rights to make their own decisions. Other questions? And I think so just to put it out there, I mean, even if you just have questions like, I don't understand something, please explain it, not just the presentation, but like any question is fair game. We might have to say, we'll have to get back to you on that, but we'll try to do our best to answer today or in future meetings.
Jalen, do you want to talk at all about our plan to bring this forward in a future meeting to do maybe a deeper dive with folks? What we're thinking
Our next steps and most immediate next steps is going to the Governor's Commission on Senior Services, the Oregon Disabilities Commission, and the Oregon Home Care Commission Advisory Council, and going through with them what they think about this and getting their feedback and their questions. We want to look at the proposed legislation in 2023 and really go through from this high level, what do we think about the legislation, and then bring that forward to the proponents of the bill. And then we're also going to sit down with and invite people to participate in a work group with us to really do that deep dive. Did I miss anything, Jen?
I think you got it.
Yeah, I just want to chime in here too that as we're thinking about agency with choice, going down this road, it's a big lift for our system. And so we definitely want to make sure that we're engaging appropriately on it, and that if you have thoughts, concerns, questions, that we're able to address those. And you can see here in the chat, Elisa, community members may send questions to our APD communications at odhs oha.oregon.gov box, and we'll circle back to you all with responses.
John also had a question. Will agency with choice magically increase workforce?
So I was actually going to put it in writing. So my magic wand broke into I had a Tinkerbell wand and it broke. So I don't think it'll magically increase workforce, but I think the hope is that if we decrease barriers and frustrations, right? So people get paid on time and they get paid the right amount of money, that they can get through the background check process quicker, that maybe we won't lose workers. And maybe people will talk about it with others who then come into the system to be caregivers because they're not expressing that level of frustration.
Do you have data to support the fact that workers are getting paid on time and with less barriers?
Well, since we don't have the program in Oregon, no, I don't have Oregon data. We could look at what other states have experienced when they've implemented an agency with choice. I'll say that there's a wide variation, and Max can jump in on some of the research they did, but there's a wide spectrum of the scope of authority for an agency with choice. Some of the agency with choice models are much more like a fiscal intermediary, like ODDS uses, where the provider, it's still a fully consumer-directed program, but somebody else is paying the bill, and then the state pays that fiscal intermediary the funds to for the privilege of getting them to pay. But there's that huge spectrum, so we would need to deep dive into that to see if it's made a difference.
And then Mary Jo's comment there, Jane Ellen, do you want me to read that?
Sure.
As an additional program rather than a replacement, what is the cost versus benefit? Seems like given Oregon already has a robust home care system, that resources should go to the problems in the existing system.
I mean, that's an option. I think the proponents of the bill would say that they have tried to address the problems and don't feel like the state is making enough progress on that.
Then it looks like Devin's question, do you anticipate this being brought back during the short session or the next long session at the Oregon legislature? And
short session.
Yeah, Nikisha commented. Speaking of the short session, we have Ledge Days coming up. Justin, do you want to mention anything about that?
Well, legislative days will be, well, we just finished September legislative days last week. November we'll have another round of legislative days, are when legislators reconvene during the interim between sessions in Salem. And most significantly, all of the committees get together and hold informational hearings. APD did not present during Ledge Days in September, but in November, we're expecting that Nikisha and Jane Ellen and team will be called on to talk about a couple of different issues. One regarding the acuity-based staffing tool used in long-term care facilities and community-based care. Another being some of the issues Jane Ellen nodded to around late payment issues for home care workers. And, those plans are still coming together. I think we'll have a lot more updates on what we may or may not be asked to present on in the weeks to come. But that's what we know for now.
Thank you. Well, we have about 5 minutes left of this meeting time today. Wait just a few more minutes to see if we have any other questions. I'm going to go ahead and drop our survey in now. Oh, looks like Kristen Milligan. Do we know the dates for the Ledge Days in November? I believe you just said those days, correct, Justin?
Sorry, I was, yes, I believe it's November 6th through November 8th.
Thank you. And folks, I just went ahead and dropped the survey for this meeting in. This is for the prior session, and then it includes just an option of what you thought about this special session as well. It's about 12:57 here. Should we go ahead and say thank you to our ASL interpreters today and our CART folks and all of our speakers, everybody who supported this event, and let folks know that we're going to get out more information about where you can hear and learn more about the Agency with Choice concept and model, where you can find more about legislative days. And please take our survey. Let us know what you thought of this meeting. And Elisa, do you want to close this out?
I think you've said it all. Jen, thanks so much. We've put the email address in the chat, so please reach out if you have questions related to the presentation. Thank you very much.
Thank you, everybody. Have a great rest of your day. It's beautiful fall day in the valley, so hopefully you'll get out and get some sun.
Thank
Take
you,
care,
everyone.
everybody. Bye.